one not need be a cost expert to notice that America's overall health has declined as spending has skyrocketed. Did doctors just suddenly get greedier? Doubtful. What massive change occurred in the last 20 years? Perhaps we should do a study. One not need to be a scientist to understand that the overall health has declined in our country, primarily because the fucking food is poison, right? The medicine is poison. The information that we put in our brains is toxic and poison, right? It's all negative, from politics to, documentaries about constant murders and shit like that, right? Like, you don't have to be a rocket scientist to know why people are depressed and why the mental health and the physical health is struggling in this country. But as far as the cost of care, you're right. You don't need to be a cost expert. You also don't need to be an economist to know why healthcare costs have gone up, from premiums to the actual cost of care. The answer to that is Obamacare, right? We know we've always had a problem with healthcare in our country, but Obamacare accelerated that by taking a $1 trillion industry to a $6 trillion industry. Well, how did it do that? In the lowest amount of terms possible, basically what it did was it gave access, it gave insurers and large medical systems access to the U.S. Treasury, okay? It started using tax-funded dollars to pay for health care, which drove up the cost, because now doctors and health insurers can slap whatever price tag they want on it, because they know the cost isn't going to be on the consumer. The cost is going to be on the U.S. government, and the U.S. government overpays for everything. So that's your answer in short. Now, if you want to dive into the details and talk about the medical loss ratio and, the 85% of revenue and the 15% that, an insurance company is allowed to use to operate, we can talk about that in specifics. But ultimately, the answer to the rising healthcare costs is Obamacare. Now, I always open up and tell my clients the same thing. If you have an opportunity to get the healthcare, to get the government out of your healthcare, you should absolutely take advantage of that opportunity. And that's what I do for my customers. I get them set up with healthcare plans that have nothing to do with their tax returns, and they are consumer-driven plans that put you in control. You can use any doctor in the country, okay? You can go to any hospital or any surgeon in the country, all right? And we also bundle in a little thing called advocacy, so we know the cost of care going in. What a novel idea, right? I can literally tell my clients down to the dollar amount what their financial responsibility is going to be for a specialist, for a procedure, for a service, and that is the answer to solving the healthcare crisis. So we're doing our small part over here. If you'd like to learn more, click on the little link and book an appointment with me, and I'd love to hear about your circumstances and see if there's an opportunity to help you.